Assalamualaikum. This is my internship report for the subject code HND602. Name Noor, edit number 16, edit 4646. Supervisor name Professor Dr. Asif Ahmed. Co-supervisor name Ms. Hina Ashraf. Hospital name Kulsum International Hospital, Institute of Food and Nutritional Sciences, Peer Meher Ali Shah, Added Agriculture University, Rawalpindi. Table of contents. Objectives of internship: introduction of KIH, internship stratagem, weekly rotations, case study, conclusion, acknowledgements, references. Objectives of internship are academic learning, career development, skill development, personal development. Introduction of KIH. It's a tertiary level hospital which provides high quality cardiac and general healthcare services to the patients. Kulsum International Hospital is an ISO 9001-2015 certified organization. Staff includes doctors, nurses, paramedical staff, technicians. Departments are emergency, which is available 24/7. Other are general diagnostic, pulmonology, gastroenterology, pathology, radiology service, general surgery, cardiology, blood bank, diagnostic team, physiotherapy, cardiac rehab, and diet and nutrition. Internship stratagem. The principle of human nutrition, nutrition care process, which also includes nutrition assessment by anthropometry, biochemical, clinical, and dietary evaluation. Nutrition diagnosis, nutrition intervention, monitoring, evaluation, therapeutic diets. Weekly rotations were as follow in the departments were OPD, Diabetes and Obesity Center, Coronary Care Unit, CCU, Resuscitation Room RR. The diseases I dealt in the hospital in different departments are as follows: OPD, celiac disease, hypercholesterolemia, nutritional anemia, eating disorders which also include anorexia nervosa and bulimia nervosa. Diabetes and Obesity Center, diabetes, obesity, renal disease. Critical Care Unit, hypertension, coronary heart disease, aneurysm, congestive heart failure, infective endocarditis, pulmonary embolism, resuscitation room, enteral feeding, NG tube feeding, NG feed supplements for ventilator patients, NG TPN feeds that can be prepared at home. Now discussing Diabetes and Obesity Center, one of the major department of the hospital. Diabetes and Obesity Center offer a comprehensive and convenient services with a core focus on the treatment of diabetes, obesity, and endocrine and hormonal disorders. Following healthcare services are provided at Diabetes and Obesity Center: diabetes management, treatment of obesity, endocrine and hormonal disorders, bariatric surgery, management of kidney disease, psychological treatment, education on lifestyle, medicine, and other therapeutics. Diabetes. Diabetes is a chronic degenerative disease. It is caused by the disturbance of metabolism of the body and of its hormonic imbalance. The types of diabetes are type 1 diabetes, that is insulin dependent diabetes; type 2 diabetes, non-insulin dependent diabetes; gestational diabetes. Type 1 diabetes, insulin dependent diabetes. Diabetes mellitus type 1 is a form of diabetes that results from autoimmune destruction of insulin producing beta cells of the pancreas. The subsequent lack of insulin leads to increased blood and urine glucose. The classical symptoms are polyuria, frequent urination, polydipsia, increased thirst, polyphagia, increased hunger, and weight loss. Type 2 diabetes, non-insulin dependent diabetes. It seldom develops before the age of 40 or above. Most people who develop type 2 diabetes tend to be overweight. Diabetes may affect blood vessels, eyes, kidneys, and nerves. Gestational diabetes. A temporary condition of diabetes, insulin resistance, that usually occurs halfway through a pregnancy at 4th to 5th month. It results from excessive hormone production in the body or inability of the pancreas to make the additional insulin that is needed during pregnancy. Expecting women with gestational diabetes are at an increased risk of developing type 2 diabetes mellitus later. Untreated gestational diabetes can lead to problems for both the mother and the child. Symptoms are frequently urination, increased thirst, extreme hunger, loss of weight, slow healing of wounds, sores, weakness, fatigue, itching, depression, body pain, ketosis, small in urine, blurred vision, that is excessive sugar in blood pulls the fluid out of lenses of the eye, causing them to thin and affecting their ability to focus. Oral disorders, dryness and burning sensation. Saliva also contains glucose in diabetic patients. The causes of diabetes are as follows: inherited, smoking, age, obesity, lifestyle risk, stress and tension. Now we will discuss case studies. Case study 1. Patient condition. Patient arrived at diabetes and obesity center as he started feeling symptoms more severely, such as increased thirst, increased urine production. Moreover, he was also lost a lot of weight due in a month. The nutritional assessment, anthropometric data: name Khalid Amjad, age 45 years, height 5'8", weight 61 kgs, BMI 20 kg per meter square, ideal body weight 68.4 kilograms. Nutritional requirements: protein requirements 82 gram per day, calorie requirements 2052 kilocalories per day, water requirements 2.3 liter per day. In the biochemical test, we can see that all the values that are higher or that are abnormal to the normal are highlighted in red. For example, red blood sugar is 186 mg per deciliter, urea is 49 mg per deciliter, triglycerides are 214 mg per deciliter, and their normal ranges are also mentioned in the table. Diagnosis: diabetes, hypertension, alert, smoker. Meal plan. This is the meal plan of this patient, which includes multigrain bread, scrambled egg, tea with ginger in the breakfast, and mid-morning snack includes apples, while the lunch includes beans vegetable salad, raita. Evening snack include green tea and nuts. Dinner includes chicken vegetable soup and grilled chicken. The serving size and colors have also been mentioned. Case study 2. Patient condition. Patient arrived at Diabetes and Obesity Center for regular checkup as he started feeling symptoms more severely. Moreover, he has gained a lot of weight in a month. Nutritional assessment, anthropometric data: name Muhammad Junaid, age 69 year, height 5'2", weight 81 kg, BMI 32.4 kg per meter square, ideal body weight 59 kg. Protein requirement 82 grams per day, calorie requirement 1770 kilocalories per day, water requirements 2 liter per day. In the biochemical test, the ranges which are not normal are random blood sugar 179 mg per deciliter, urea 50 mg per deciliter, and the triglycerides 218 mg per deciliter. Diagnosis: diabetes, hypertension, alert, obesity, age. The diet plan includes: breakfast includes multigrain bread with poached egg and tea with ginger, while the mid-morning snack includes cucumber with hummus. Lunch includes beans with vegetable salad and raita. Evening snack includes green tea and nuts, and dinner includes chicken vegetable soup with grilled fish. The calories and serving size have also been mentioned side by side. Case study 3. Patient condition. Patient arrives at Diabetes Center for the follow-up. Moreover, he has lost a lot of weight. Nutritional assessment includes: the anthropometric data is as follows: name Rashidna Khan, age 26 years, height 5'10", weight 70 kg, BMI 22 kg per meter square, IBW is 75 kilograms. The nutritional requirements are as follows. Protein requirements 90 gram per day, caloric requirements 1900 kilocalories per day, water requirements 2.4 liters per day. In the biochemical test, the ranges which are again not correct are mentioned in the red color, and they are as follows. Random blood sugar 186 mg per deciliter, urea 46 mg per deciliter, triglycerides 213 mg per deciliter. Diagnosis: diabetes, hypertension, alert smoker. Meal plan: we are giving him the DASH diet. It includes breakfast whole wheat chapati with egg whites and green tea. Mid-morning snack includes grapefruit. Lunch includes chickpea curry with whole wheat chapati. Evening snack includes apple, carrot and beetroot juice with nuts. Dinner includes chicken vegetable soup with grilled chicken. Dietary guidelines for diabetic patient are as follows. Walk for about 15 to 30 minutes daily. Before taking each meal, drink 1 glass of water. Avoid cold drinks, bakery products, oily and fast food. Raw fruits are better than juices. Only 2-3 fruits consumed daily. Take all fresh vegetables. Take low-fat dairy products. Avoid Tetra-Pak milk, yogurt, mayonnaise, ice cream. Consume chicken, fish and egg. Avoid beef, mutton and frozen meat. Avoid foods that contain high glycemic index or sugar like canned food. Use sweet potatoes, turnip, etc. Use canola, mustard or olive oil. Avoid butter, ghee and margarine, but only 1 teaspoon of homemade desi ghee or butter can be used daily. Divide the meals into small portions and almost 4 to 5 meals. Check your blood glucose level daily and note on diary. Antidiabetic foods are as follows. Kidney beans, onion, soya bean, buttermilk, flour, legumes, cinnamon, fenugreek seeds, mango leaves, apple, chana, bengal gram, bitter gourd, broccoli, yogurt, garlic, grapefruit, jumble fruit, that is known as jamuns. Skills that I learned during internship are as follows. From this internship, I gained much knowledge about food supplements, exchange list, calorie countings and much more. I learned specific guidelines and benefits of different foods in specific disease. I learned how to interact with patients admitted in medical wards and also with those who came for a follow-up, effective diet counseling, billing system for diet menus for patients admitted in the hospital, diet plan construction with calorie calculations according to patient's BMI and medical conditions. Conclusion. Skills I have learned: effective diet counseling, therapeutic diet plans according to the biochemical lab results, food and drug interactions, how to deal with different patients, diet plans, diabetic, obese and unfit and OBD patients. Acknowledgements. I would like to express my deep gratitude to Allah Almighty for His blessings upon me, Professor Dr. Asif Ahmed for approval of request to join Kasum International Hospital, Ms. Hina Ashraf for her valuable time, guidance and suggestions, all teachers for their guidelines, support and academic supervisor, and my parents for everything. These are the references from which I gathered all the data regarding the disease and all the stuff. Thank you so much.